Thank you so much for the opportunity to talk to you today about video-based surgical coaching. I do have two disclosures. The Academy for Surgical Coaching is a nonprofit organization, and I serve as co-founder and president, and I will be talking about the Academy today. I also serve as a consultant for Johnson & Johnson on their Global Education Council, but do not receive personal compensation for either of these activities. So my goal over the next 15 minutes or so is to talk to you about what surgical coaching is, to describe the developing evidence base, and to talk about how we can move surgical coaching into real-world practice. So let's start out by talking about what surgical coaching is. Coaching is unlocking a person's potential to maximize their own performance. It's about helping them to learn rather than teaching them. It's about providing objective and constructive feedback to help someone else recognize what works and what can be improved, and inspiring them to maximize their potential. Now, when we talk about surgical coaching, we're talking about a specific type of coaching, and our coaching is really unique from many of the other ways in which we as surgeons have traditionally been exposed to coaching, such as leadership coaching, executive coaching, or wellness coaching. When I talk about surgical coaching, I mean focusing specifically on using coaching techniques in order to improve our clinical and operative performance with the goal of optimizing quality and patient safety for those we take care of. Coaching is unique from other different educational paradigms as well. It's really unique from teaching and mentoring, again, something that we all have done throughout our careers. Coaching is based on asking open-ended questions, enabling self-discovery, dispelling false feelings and beliefs, and really focusing on how to prepare someone for the future. It's focused on growth goals and really based on the concept of individualized learning. Coaching is based on, again, individualized learning, which means that it's goal-driven. It requires active participation on the part of the person being coached as well as the coach. It's tailored to the experience of the person being coached, and it's iterative and longitudinal. The goal with coaching and surgical coaching is really performance improvement. So it's looking at your practice, setting goals, making intentional changes to how you do something, reflecting on the impact of those changes, and then setting new goals. So it's really the circular model of performance improvement. When we talk about surgical coaching, it really can apply to any of the different domains of surgical performance. That includes technical skills, cognitive skills, interpersonal skills, and something we call self-regulation, or how you sometimes can get stressed in the operating room, how you respond to that, and then some coping strategies to help make sure that when things don't go as smoothly as you'd like during an operation, that it doesn't impact your ability to perform the rest of the operation. In order to do that, in order to help an individual to look at the different components of their surgical performance, a coach has to be good at the following different competencies. So they have to know how to actively listen. This is critical to developing trust, rapport, and developing powerful questions. Listening can lead to powerful inquiry or the use of open-ended questions to challenge in a non-competitive, non-threatening manner. And then finally, how to give effective feedback, or feedback that's descriptive, specific, and non-judgmental. We're going to be talking primarily about video recording, and there are a number of different reasons that we really propose video-based coaching is better than live observations. And it's because, number one, it allows an individual to view their own performance, and this has been shown to be much more successful in sustaining behavior change. It confers a time savings of 50 to 80% and removes concurrent responsibilities for full concentration on performance and not worrying about the patient on the table. Finally, it can mitigate medical, legal, and credentialing complexities on the part of the coach. So what is the evidence out there to support surgical coaching? The first study that we did was in Wisconsin, where we partnered with our state organization, our state surgical society, in order to have a statewide coaching program. We trained coaches throughout the state who were nominated by their peers to serve as coaches, and then recruited people who were active surgeons in practice to participate. We found that surgeons were able to identify specific coaching goals related to technical, cognitive, and interpersonal skills, that those goals could be effectively targeted during a video-based or live coaching session, that surgeon coaches could acquire and effectively employ peer coaching principles through the training that we provided, that both coaches and participating surgeons found the coaching program to be highly valuable, and that surgeons reported making sustainable changes to their practice as a result of participating in the program. At the end of this program, we had developed a training module that we were able to use in future programs. We did, however, find that there were some challenges to surgical coaching. The first was scheduling. Even though our program was designed to have 4 longitudinal sessions, nobody was able to complete that program despite the fact that they really wanted to continue. So our solution to this was really to integrate our future programs into quality initiatives and surgical societies where people were already carving time out of their schedule to come together to focus on improving their performance. In addition, there were challenges related to capturing the audio video data to video storage and then to interface for review. Our solution here was to limit the laparoscopic technical capture for the time being, and then to partner with industry to try to come up with better solutions to how we can do this. The next thing that we did was we partnered with Justin Dimmick and the rest of the Michigan Bariatric Surgery Collaborative and submitted an R01 that was funded that allowed us to take our surgical coaching program and employ it in the Bariatric Surgery Collaborative in the state of Michigan. Here we found that there was a significant decrease in the operative time for surgeons who performed sleeve gastrectomies after they participated in our coaching program. You can see here that the participants had a 14-minute improvement in their operative time, and this is an adjusted analysis, with really no improvement for those that served as our coaches or matched non-participants within the program. To follow up on this, our next study, which is currently open and enrolling participants, is a video-based collaborative learning to improve ventral hernia repair. This is a partnership with the Abdominal Core Health Quality Collaborative and is funded by the Agency for Healthcare Research Quality as another R01. This is a prospective randomized trial of 54 surgeons, and our goal really is to compare surgical coaching to asynchronous video-based feedback, where one surgeon records a video and another surgeon watches that video and then gives them feedback in a written way through an interface that is on the computer. And then we're going to compare that to a waitlist control. Video capture is required for all 3 arms to look at self-assessment and blinded expert review, utilizing a previously validated instrument to look at technical skill. Our primary outcome is change in 30-day procedural complications, but we're also looking at 2-year recurrence rate. So now let's talk about moving this into real world practice. It's really important that we understand that outcome measurement does not lead to practice improvement, right? We have gotten quite good at outcomes measurement. All of us participate in different registries, and we have really developed the capacity to follow our patients and see how they do. The problem is that we don't have structured ways to actually act on that data. So these were 2 studies that came out in JAMA in 2015, which looked at participation in NSQIP and showed that there was really no association between participating and non-participating hospitals in terms of improvements in complications or mortality rate. And why is that? Well, the issue is again, we've been focusing most of our time when it comes to quality improvement in this idea of assessment. So looking at benchmark quality metrics. And earlier today, we heard about the work that's being done in video-based assessment. So again, trying to figure out how can we provide a time shot, a quantitative shot in time where we look at somebody's performance and tell them how they're doing relative to others. Once you know where you're at, though, you have to have a way to improve. And this is where surgical coaching comes in. Because again, the goal is to identify areas and set goals for improvement, reflect on practice, and then make intentional adjustments with accountability by your coach. So as we think about moving from outcomes measurement to performance improvement, right, again, we need to know where we're starting from. So pairing with video-based assessments and measurements, including patient outcomes and assessments of performance is going to be really important, but it really has to be paired with performance improvement. So whether that's through surgical coaching, asynchronous feedback, or other methods by which we can really look at and analyze what are the changes we want to make in our practice and hold each other accountable. This is a key opportunity for professional surgical societies to really be involved in the development of procedure-specific VBAs and also to provide infrastructure for coaching programs. And there are a number of surgical coaching programs that are being developed across the country to help support surgeons as they're going through this. These are just some examples of the programs that I'm familiar with. In addition, there is an industry that's really being developed to support the video recording and capture and analysis of cases, both in terms of assessment as well as in terms of review and coaching. The Academy for Surgical Coaching is a nonprofit organization that aims to fill a need. And really, our goal is to focus on training surgeons in how to be coaches. So we focus on the fundamentals of surgical coaching, how to operationalize it, and then we give people the opportunity to practice surgical coaching with others that are trained. The way that the individual surgical video-based coaching process works is that you have an introductory session where you identify your learning goals and develop an action plan between a coach and their participant. At the first coaching session, you look at details of a case, you start to review your first video, and come up again with areas that you want to make changes in your practice. At subsequent sessions, then you follow up and your coach holds you accountable to see what changes you've made and what that impact might be on your performance. For this, we're able to provide CME credits. So in summary, video-based surgical coaching offers an individualized approach to performance improvement and continuing education that is based on adult learning principles. Video-based surgical coaching addresses a major gap in medical education by providing feedback and a major gap in quality by providing action plans and accountability. There is a developing evidence-based and startup community to support video-based surgical coaching, and video-based surgical coaching holds great promise to meet surgeons' needs for continuous professional development, as well as an adjunct to traditional training paradigms. So here are just a couple of different ways that you can get involved if you're interested. As I mentioned, we have this ongoing collaboration with the Abdominal Core Health Quality Collaborative. This is an RO1 funded study. If you're interested in participating, participation is free. You can contact me and I'd be happy to provide you with some more information. Or if you're not a member of that organization, you're interested in either being trained as a coach or getting coaching, please feel free to reach out to us at the Academy and we'd be more than happy to help you. With that, I thank you for your attention.